Hi guys, welcome back to my channel which is Realhomeopathy. I'm back with a new lecture which is on psychology, as you all have requested me to make a lecture on psychology. So today the topic I'm going to explain is on the Causticum remedy and the constitutional treatment. Based on the constitutional treatment, selecting the totality of the symptoms, how are you going to treat the patient. So I'll be explaining you about how the Causticum patient will be. So on seeing the patient, what are the considering factors that you can take into the consideration and give this remedy Causticum. So let's begin the class. So Causticum is the keynote of this Causticum is idealistic. So even I'll be letting you know the words in Kannada. So this is how you can make it interesting in this lecture. So Causticum is fascinating constitutional remedy, and Causticum is quite uncommonly prescribed in these times. So the first point of the Causticum will be the Causticum patient is idealistic, empathy and injustice. What is idealism now? So idealism means ಆದರ್ಶವಾದ ವಾಸ್ತುಗಳನ್ನು ಆದರ್ಶ ರೂಪದಲ್ಲಿ ಚಿತ್ರಿಸುವುದು. It is known as idealism. Idealism means ಆದರ್ಶವಾದ ವಸ್ತುಗಳನ್ನು ಆದರ್ಶ ರೂಪದಲ್ಲಿ ಚಿತ್ರಿಸುವುದು. So this is idealism. Next, coming to the empathy. Empathy means ಅನುಭೂತಿ. Anubhuti, another synonyms I'll be giving you is ಹೊಂದಾಣಿಕೆ and ಇತರರ ಭಾವನೆಗಳನ್ನು ಹಾಗೂ ಅನುಭವಗಳನ್ನು ಗ್ರಹಿಸುವುದು. So understanding the feelings of the other person, that is where we consider it as the empathy. So firstly was idealism, empathy, and the third one is injustice. So injustice means anyaya, something bad happening to the others. So that is injustice. So these are the 3 points that you can understand the Causticum remedy. Most central for Causticum is idealism. Causticum's main central idealism is the main point. So Causticum's idealism is based on 2 factors, which is namely the deep empathy for suffering of others. There is deep feelings for others, okay, which is maybe the factor that we consider is the person is very empathetic to others' bad situations, okay, and for suffering of others there will be the empathy. Secondly, deeply felt sense of injustice, okay, there is something sensual that the person is going through something wrong. So this is where you understand the injustice which is happening for others. So the Causticum patient will apparently expose themselves in explaining these things to the society. So this is how you analyze the case. Whenever the patient is explaining in front of you, then you can analyze this Causticum personality very easily. So third element is it helps to differentiate between phosphorus and Causticum is highly analytical mind. Phosphorus personality is going to be highly analytical. So phosphorus and Causticum's both differentiating factor is the analytical mind. Next, coming to majority of the Causticum patients are male. Almost females are quite reduced, you will say. Majority of Causticum are male. Many of them have interest in broad social issues. We consider there are broad social issues, and so if you suspect a case wherever the person is having interest in social issues, then Causticum then inquire about their reaction strongly to the news on it, maybe on the television or the radio. So you just need to inquire the patient related to that, how the patient will react in the televisions or radio whenever they hear some bad news which is going on there. So many Causticum patients feel upset or angry when they listen to it. When they listen to it, the patient will apparently they are angry or that they are very upset. So this is how you can analyze the case. Causticum write letters frequently to newspapers and to politicians attempting to right social injustices. So whenever you think Causticum patients always cannot tolerate injustice that is happening to others, or it might be happening to himself. So this is the main differentiating point. I'll be considering even the Natrum here, the phosphorus, the sulfur patient. So this is all how you have to understand the personality of all of these remedies. So some focus on racial discrimination or the divisiveness of individual freedoms. Important to differentiate between Natrum campaigner and Causticum campaigner, and how. Natrum is a natural campaigner. So Causticum nature is to fight injustice and infringement. Okay, infringement means it is kanunu or it is a bhanga. Bhanga means violation. So kanunu means which is infringement means it is kanunu. Bhanga. Bhanga means violence. They cannot tolerate this. They cannot tolerate any violence that is happening around them. Something bad happening to the society. They cannot tolerate such news. So there is a racial discrimination. Some Causticum nature to fight injustice and infringement of personal freedoms. So this is how Causticum's nature to fight injustice and infringement. Natrum suffer from various injustices or from natural calamities or diseases. So Causticum fights injustice and kanunu, which is infringement of personal freedoms. But whenever you come to Natrum, it suffers from various injustices or from natural calamities or from diseases. So this is how Natrum you can differentiate easily. Natrum child when dies from muscular atrophy, he will start charity and become passionate in its support. So this is a Natrum patient. Natrum who has been a victim of sexual harassment will start a campaign. So the person who is very much experienced in such conditions, there might be muscular atrophy, so they are going to begin a charity of the similar way. So person is having any skin disease or any kind of sufferings, any cancer or any AIDS, so they are personally going to begin the charity. So this you can consider it as a Natrum. So particularly when it has happened to them, so in that case only they will begin a charity. So that is the Natrum, but Causticum is not like that. The Causticum doesn't even have to be very keen that it has happened to him, but whenever it happens to the society as well, the Causticum patient becomes sad or upset or angry and just literally doesn't tolerate violence at all. So this is Causticum and Natrum difference, I can say. So he does not to punish perpetrators of such harassment. To punish perpetrators of such harassment, he does not have to have been a victim himself to campaign here. Causticum patient doesn't have to have been a victim to be a campaigner here. The best investigative journalists are often Causticum. Journalists are often Causticum constitutionally. Okay. His primary aim is to unmask corruption and official secrecy in the interests of greater individual freedom and a more informed, caring society. So this is a Causticum personality. Causticum is dedicated to truth in many cases. Causticum is dedicated to truth in many cases. Naturally, a great many revolutionaries are liable to be Causticum. Constitutionally great many revolutionists are Causticum, and investigative journalists are Causticum. So not all Causticums are considered as a political activist. Please, I need to mention this here, because not all Causticums are activists. Politically, they need to not be there. Whenever we need to consider a Causticum patient, they may need not to be a political activist as well. Okay, they might be anywhere, but they are preferably more in male. Second point, first one was about the idealism and empathy and injustice. That was the total 1 point. Second point is the disillusionment and the grief. So in Kannada we will see what is disillusionment. Moha vimochane. So maralu in Kannada. So disillusionment is moha vimochane. Grief, it is a maraluvudu. We can say that in Kannada. So this is going to be the grief and disillusionment. Okay. So Causticum is little more sensitive here. If one plan fails, he will be ready with the other one. The one plan fails, the other plan will be ready with him. Such unsuccessful Causticum eventually sink into despair and bitterness. So this is how they are going to suffer into despair and bitterness. Failure to realize his dreams. It is not the only stress which can lead Causticum to despair. Causticum has a warm and romantic heart and is usually passionate about his loved ones here. Causticum is safe to give in degenerative osteoarthritis. Causticum is safe to give in degenerative osteoarthritis, but not in inflammatory osteoarthritis. I need to mention that here. Okay. Next one, there is obsession. Coming to the mental symptoms of the patient, there is the obsession. Obsessive compulsive disorder is a must. I have to mention it in Causticum. Okay, obsession, introversion and anxiety. Gilu in Kannada. Not all Causticums are going to be extroverts and not all Causticums are going to be passionate. Female Causticum are more likely to be introvert and anxious here. This obsessiveness may be in the form of fastidiousness as seen in arsenicum and natrums. Potassium salts all have a certain mental rigidity here. So introverted Causticum, there may be problem with repetitive negative thoughts. There may be a problem with this. So just as Lachesis must find an outlet for his powerful sexual energy or become anxious, so Causticum seems to become anxious when he does not have an external focus for his mental energy. So Lachesis must find an outlet for his powerful sexual energy. So the same way, so it will become anxious, Lachesis. So Causticum seems to become anxious when there is no external focus for his mental energy. So this is the differentiation between the focus of both the Lachesis and the Causticum. Lachesis' main focus is on this powerful sexual energy to relieve that, but Causticum is not that. Causticum's external focus for his mental energy is the main essential point. Next one expression of this is obsessive compulsive disorder, which I say is OCD. After prolonged distress, Causticum may start to be obsessively check that doors are locked. Whether the doors are locked. Okay. Old age finds a lot of Causticum becoming more anxious and more withdrawn. Old age people become more anxious and more withdrawn from themselves. Elderly Causticum individuals are often frail, timid and prone to confusions. Okay, this is a Causticum female or elderly Causticums, we say that. So the differences between the Causticum which is elders, so this is the main point you need to consider. They are very frail, timid and confused. They are very sensitive to slightest adverse influence such as excessive noise or the slightest bad news, and little things set them on nerves off, resulting in trembling, agitation and a mild state of panic. So there is trembling, agitation and a mild state of panic. So 3 points. Okay, the patient are frail, timid and prone to confusions, which results in trembling, agitation and a mild state of panic. So next we will be seeing is about female Causticum. How are the female Causticum going to be? Let us ask that and let us go through. Majority of the Causticums are male and 3/4 of them are male. Only the one part of 4/4 is females. So female Causticum are less idealistic, less analytical than introverted male. They're less analytic, less analytical, and less idealistic here. So these are female Causticum. So female Causticum appears to be a sensible, anxious and independent person. Easily she moved to tears but is not intense emotionally. So she easily moved to tears but she is not anxious or not intense emotionally. Okay. The person, the female, is very less rigid and very formal. Suffers from anxiety induced confusion. So let us overall see the physical appearance of the Causticum patient. Okay, so the Causticum patient is very slim, hairy, physically. The patient is slim, hairy, physically. So face is angular and tends to become hollow and gaunt with age, with deep facial creases. So this is where you see the Causticum. Okay. And this was all about the Causticum, the main points which you need to understand on what basis you need to prescribe this Causticum remedy is going to be more helpful. And this was it about the Causticum, and this was it about the psychology lecture. So based on the mentals, you can just understand the patient's personality and then prescribe. You have to prescribe whenever you are prescribing only for mentals. You need to prescribe it in the 200 potency and go to the higher potencies like 1M and LM potencies like 10M also. So this is how you need to reach till the highest peak. You have to go to the 10M potency and come back. Okay, next remedy, whenever you're trying, you always need to try in the 200 potency and boost it up to 1M and 10M potency. So this was it about the lecture, and I would like to ask you all to kindly like, share and subscribe to my channel if you seriously liked my lecture, to get more updates on my videos. Okay, see you in the next lecture. Tada, bye bye.